Associate Investigator with the Centre for Research Excellence in Newborn Medicine. In 2019, I was appointed as a Senior Project Officer to Safer Care Victoria. Our aim was to develop guidance for babies born extremely preterm at 22 to 25 weeks gestation. To develop this guidance, an expert working group was appointed, and the group consisted of a multidisciplinary range of professionals, including consultant obstetricians from both tertiary centres and non-tertiary hospitals, paediatricians, neonatal nurses, midwives, and also a consumer who was a mother of the baby born extremely preterm. Well, first of all, we'd identified that there were really wide variations in care of both women and babies born between 22 and 25 weeks gestation in Victoria. Secondly, we know that worldwide there's been an increased willingness to provide intensive care for really tiny babies born at these very immature gestational ages. The Extreme Prematurity Guideline for births at 22 to 25 weeks gestation comprises 4 really important components. The first component is care of the mother who presents in threatened preterm labour at 22 to 25 weeks gestation. The second component is care of the baby who's born at 22 to 25 weeks gestation. The third component is the parent information sheets about what it means to have a baby born that early. And the fourth really important component is a consensus statement around the zone of parental discretion. Decision-making for babies born extremely preterm should be shared between the treating team and the parents. The zone of parental discretion refers to situations where it's ethically legitimate for parents to make the final decision about palliative or active care for their baby. This is applicable in situations where the outcome of medical treatment remains uncertain. Our consumer advisory group at the Centre for Research Excellence in Newborn Medicine played a really important and key role in the development of this guideline. Some of the parents whose babies were born many years ago told us they didn't receive any written information and said that would have been really helpful for them in making a decision about whether to offer intensive care or palliative care for their baby. Many parents explained feeling really confused by all the information they were being given, and so to have something tangible to read and to guide their questions for their doctors would have been really helpful. And we took all this on board when we developed the parent information sheets. After the first draft of the guideline was developed, the guideline went out for extensive public, peer and sector review. And a really important part of that review was going back to our consumer advisory group. Based on the feedback from the parents, we refined the guidelines and the parent information sheets even further so that the final product reflected exactly what the parents had told us was really important to them. The Extreme Prematurity Guideline and all the downloads, including management of the mother, management of the baby and the parent information sheets, are all available on the Safer Care website.